So a very common occurrence when someone is experiencing knee pain is associated with patellofemoral pain syndrome. And that is sort of an imbalance in the structures associated with the tibiofemoral joint, including the patella, as they're moving through the locomotion patterns in walking or running, and potentially in jumping as well. So as a result of that, we find that there's usually some predisposing mechanisms associated with what's causing the influence there. Could be some weakening, could be some tightening, and so better off to determine exactly what is going on. So we often see a decrease in speed, symmetry, and cadence. So if they're experiencing unilaterally, we're going to see some changes in contact time. We're going to see some changes in stride length as well as step length, and just the overall percentages during the spatial temporal pattern. So something to definitely take into consideration. A lot of times that patients may not experience the patellofemoral pain issue until they get into, the first kilometer or even a little bit longer. So that's why it could be important to make sure that you take them out long enough. We do have some relationships to how the foot in pronation, supination, or eversion, inversion of the calcaneus, and the influence through that contact phase. So that's something also to take into consideration. Associated with that is going to be the gait line, or how the center of pressure is going to be influenced as they walk through that contact phase. So when we see some abnormalities, either potentially a dramatic increase in pronation or a dramatic increase in supination, walking on the inside of the foot, walking on the outside of the foot with their constant pressure, that's going to have some potential indication as to whether or not we need to make some changes to their mechanics, which could be leading to their problem, as well as limiting our ability to perform the appropriate intervention and complete the resolution. Also, we see some compensatory strategies in the propulsion gait. Typically, when they're experiencing knee, that increase in moment on that affected side, they're typically going to be limited, and they may not want to actually create the appropriate propulsive mechanisms associated with going from the late stance phase into that early swing phase. And not only will you potentially see a decrease in that plantar flexion moment, but possibly an increase in the hip flexor moment. Also, as a result of compensatory mechanisms, because when they go into that contact condition, so the increase in ground reaction forces upon landing into that contact phase, they may actually spend a little bit more time, and they may actually create a compensatory mechanism and decrease that moment by using a shorter stride length. And as a result of that, also the attack angle, so when they heel strike, is going to be shorter than on the potentially unaffected leg.